What is IBS? Well, IBS is a functional, oftentimes chronic disorder of the gastrointestinal tract, and oftentimes it's involving intestinal inflammation. It can include issues with gut motility, imbalances in gut bacteria, and it's oftentimes characterized by its symptoms. So that can include bloating, it can include gas, constipation, diarrhea, that sort of thing. It's so common actually that they've now created different categories of IBS. So there's IBS-C, which is where the patient is experiencing more constipation, IBS-D, where the patient is experiencing more diarrhea, IBS-M, where they're having a mix. So they might have some back and forth between the constipation and diarrhea. Some people ask, well, what's the difference between IBS, irritable bowel syndrome, and IBD, inflammatory bowel disease? And the biggest difference is in severity. So IBD is going to have physical damage to the gastrointestinal tract, whereas IBS is that functional piece. So you're losing function to some degree, but it's not showing up with physical damage. When we think about the gastrointestinal tract, about 90% of our immune system is actually located right underneath what are called the villi, and those are projections that go into the actual tract itself, and that's what helps us to absorb nutrients from the foods that we're eating. And so when that lining gets impaired, then that can trigger the immune system. And so that's why digestive health is so important, and the goal is always to improve digestion when it is dysregulated with something like an IBS. Even though there may not be physical damage with IBS like we would see with IBD, something like Crohn's or colitis or diverticulitis, those are going to be your IBD. With IBS, the goal is always to improve digestion when it is dysregulated with something like an IBS. Doesn't matter if there's physical damage or not. With an IBD, the same goal is also true. Something like a Crohn's or colitis or diverticulitis, where you are seeing physical alterations to the gastrointestinal tract. But certainly with IBS, that's signaling that there is dysfunction. And so my goal and our goal in the practice is to improve digestion, improve oral tolerance, which means oral tolerance is basically like our default. So when we eat a food, we don't have an immune response to that food. And so as oral tolerance increases, we see that we have less immune responses to foods. And all of these different goals are revolving around the same idea, which is in the patient, we're building resiliency so that when they are inevitably exposed to a foreign antigen, whether that's food or not, we're making their body resilient so that they can tolerate that without a trigger into symptoms or issues that way. The other piece is our immune system, since so much of it is located in the GI, it's incredibly important to keep that area secure. So all of the little junctions that hold our cells together in the gastrointestinal tract, when there's issues there and foods get through, that can trigger inflammation. And we know that there is a connection between the gut and the brain. And so inflammation in the gut can actually be transferred to the brain and vice versa. So especially when we're dealing with traumatic brain injuries or concussions or things like that, we want to make sure that inflammation in the gut is kept under control. And so nutrition becomes really important when we think about IBS. A lot of the time you'll hear, oh, well, if you have IBS, you should do a FODMAPs diet. Fermentable oligosaccharides, monosaccharides, disaccharides, etc. So basically, simple and some complex sugars are to be avoided. That can help a lot of people. There are many causes of IBS, and so depending on the cause, that's kind of how we dictate the best nutrition for that individual. So, for example, if someone's IBS is caused by improperly broken down food proteins that are triggering inflammation and an immune response, then we're actually going to be looking more at, does that individual have enough stomach acid? Do they have enough bile acids? Which types of foods are they not breaking down? If the cause of the person's IBS is more related to the gut bacteria, what is their experience? Are they having bloating? Are they experiencing SIBO, or have they had SIBO in the past? SIBO meaning small intestinal bacterial overgrowth. IBS can be caused just by poor diet, or stress, or things like that. So those are all of the different pieces that we're taking into account when we address an individual with IBS.